Blood pressure is one of the most critical indicators of cardiovascular health, guiding diagnoses and lifelong treatment decisions for millions worldwide. Yet, clinical trials demonstrate that everyday procedural errors frequently distort readings by 10, 20, or even 30 millimeters of mercury. The first and most prevalent error is using the incorrect cuff size. An inflatable cuff operates by transmitting pneumatic pressure through soft tissue to compress the brachial artery. If the bladder is too small or narrow for the arm circumference, it requires excessive pressure to occlude the vessel, artificially overestimating systolic and diastolic pressure by 2 to 10 millimeters of mercury. Conversely, an oversized cuff underestimates true pressure. International guidelines specify that the inflatable bladder should encircle 75 to 100% of your upper arm circumference. The second critical error is placing the cuff over clothing or rolling a tight sleeve up the arm. Thick fabric introduces oscillometric measurement distortion, while a tightly rolled sleeve acts as a tourniquet, impeding venous outflow and falsely elevating readings. For true accuracy, the cuff must be applied directly onto a bare upper arm, centered 1 inch above the antecubital fossa. The physical position of your body during measurement directly engages the laws of fluid dynamics. The third major mistake is failing to support the arm at heart level. According to hydrostatic physics, the pressure inside your arteries changes with vertical height relative to the heart's right atrium. For every inch your arm rests below mid-sternum level, the gravitational weight of the blood column artificially adds approximately 1.8 to 2 millimeters of mercury to your reading. Furthermore, letting your arm dangle without table support forces isometric muscle contraction, which further drives up pressure. The fourth mistake is sitting on an unsupported stool or letting your feet dangle off the floor. When your back and feet lack solid support, core stabilizing muscles remain active, routinely elevating diastolic and systolic pressure by 6 to 10 millimeters of mercury. The fifth mistake is crossing your legs at the knees. Crossing your legs compresses peripheral veins and shifts venous blood back towards the central circulation, increasing cardiac output and transiently raising systolic pressure by 2 to 8 millimeters of mercury. To ensure baseline accuracy, sit in a chair with firm back support, keep both feet flat on the floor, and rest your bare arm on a desk so the cuff aligned exactly with the center of your chest. Your autonomic nervous system is extraordinarily sensitive, responding instantly to internal discomfort and external engagement. The sixth common mistake is measuring blood pressure with a full bladder. When the urinary bladder becomes distended, stretch receptors stimulate afferent autonomic pathways, triggering the vasovascular reflex. This sympathetic surge constricts peripheral blood vessels and can elevate blood pressure readings by 10 to 15 millimeters of mercury. Always empty your bladder before sitting down to measure. The seventh mistake is talking, answering questions, or actively checking your smartphone during the measurement cycle. Speaking or cognitive processing triggers acute emotional and neurological arousal, which clinical studies show can increase systolic pressure by 5 to 15 millimeters of mercury. Complete silence should be maintained by both the patient and the practitioner throughout the reading. The eighth mistake is rushing into a reading immediately after sitting down. Walking from another room, climbing stairs, or hurrying creates residual physical and adrenergic exertion. Cardiovascular guidelines emphasize sitting quietly in a neutral, calm environment for at least 5 full minutes before pressing the start button, allowing heart rate and peripheral vascular tone to return to true resting baseline. Chemical substances and environmental factors can temporarily distort vascular tone long before a cuff is inflated. The ninth mistake is measuring blood pressure within 30 minutes of consuming caffeine, smoking nicotine, or completing vigorous physical exercise. Caffeine blocks adenosine receptors and can stimulate adrenal epinephrine release, causing transient arterial stiffness. Inhaled nicotine acts as a potent adrenergic stimulant, provoking rapid peripheral vasoconstriction and heart rate elevation that can artificially skew readings for 30 to 45 minutes. Similarly, while regular physical exercise produces long-term cardiovascular benefits, acute exertion temporarily alters hemodynamics and vascular resistance during the recovery phase. In addition, exposure to cold room temperatures induces cutaneous vasoconstriction to conserve heat, which can elevate systemic vascular resistance and blood pressure. For accurate clinical tracking, ensure that measurement occurs at comfortable room temperature, at least 30 minutes after food, caffeine, nicotine, or strenuous physical activity. The 10th, and perhaps most consequential mistake, is taking only a single measurement and relying on non-validated devices. The first blood pressure reading of any session is frequently the highest due to initial apprehension, subtle cuff surprise, or white coat reactivity. Major cardiovascular guidelines, including the American Heart Association and European Society of Hypertension, recommend taking 2 or 3 readings spaced 1 to 2 minutes apart, discarding the first if it is markedly leveraging the remaining values to establish your true resting pressure. Furthermore, verify that your home monitor is a clinically validated upper arm oscillometric device registered on authoritative validation databases like Stride BP. While wrist monitors are popular, they are exceptionally sensitive to arm positioning and wrist flexion, making them less reliable for routine screening. Establishing a consistent routine, measuring in the morning before breakfast or medications, and in the evening before bed, following correct posture and rest, ensures that the numbers you and your physician rely upon reflect genuine cardiovascular function. Medical disclaimer: this video is for educational and informational purposes only. It does not constitute medical advice, diagnosis, or personalized hypertension treatment. Always consult a qualified physician, cardiologist, or healthcare provider regarding individual blood pressure targets, medication management, or medical symptoms.